Hi, my name is Yeji Kim, and I'm a nurse, and I work at Lucille Packard Stanford Children's Hospital.
Hi, everybody. I'm Lillian, a pediatric cardiac ICU physician, also at Stanford. I think it's important to note just that the opinions that Yeji and I are going to express during the video are not reflective of Stanford University, but just reflect our own opinions. But I think we're both happy to be with you guys today.
Nice to see everyone. And we are just super excited to share a little bit about heart diseases and just what makes a heart healthy versus not. A lot of the questions that we get is, what is congenital heart disease? That question comes up very frequently. Well, if you think about it, congenital means that's present at birth. So this means that babies are born with a heart that hasn't either formed completely, or certain pieces are missing, or there's certain holes in different types of irregular pathways. They're born with this type of issue, and in the CVICU, cardiac ICU, I get to take care of all of these babies, and eventually they grow up to be middle school, high school adults one day, if all goes well. So love to share more about this as we go on.
Yeah, and I think what's really important is to recognize how far the field has gone in congenital heart disease and congenital heart surgery, and how surgeons have really become these amazing artists, plumbers, technicians, and they can really use the materials that kids were born with and give them a kind of plumbing that is compatible with hopefully a long and healthy life. So Yeji, you've been a nurse now for how many years, and what kind of got you involved in being a cardiac nurse, and what do you enjoy about your day?
Well, I have been a pediatric cardiac nurse for about 5 years now, and it has just been so fun, so challenging, and just such a blessing to be able to help these kids recover from open heart surgery and live a nice, happy, fulfilling life. A lot of the times, these babies do come out of the operating room with, pretty invasive surgery, but after hopefully just a few days in the ICU, they can recover and move on to a different type of unit that helps prepare them for a normal life at home. A lot of the times, it's important to mention that these kids are just very resilient, and they go through tremendous lengths to go back to how they were previously before surgery, and in the sense that they can still go to school, they can still be interactive with their friends, and do a lot of activities just like you and I. So my day consists of taking care of these babies and toddlers, pretty much any age group. I help them with their medications, making sure that they're safe, that their pain is managed, that we can kind of help them get back to normal. And that includes helping them walk again after surgery, being in bed for so long, helping them eat, and just kind of normalize their life to make sure they're safe and healthy after they leave us. And what about you, Lillian? How did you get involved in this such a specialized role?
Well, I've always really enjoyed taking care of kids, and I think that this population of kids are especially strong. And I think every day they teach us a little bit about human strength and human capacity, and the ability to recover from life's challenges. And so I feel really blessed to be able to work in a unit like ours, where we see really, really complex cases where our surgeons really have to do a lot of amazing work to work with what the kids have to hopefully restore the plumbing, kind of restore the circuitry so that it's ideal and these kids can be really healthy. And I've been now at Stanford for my fourth year, and before that, I was in Washington, D.C. for several years. And I think every case, every child is so different, the way they respond to surgery and life's challenges. So it's always really interesting and really a privilege to be able to do that. Do you think we
Definitely,
should? Oh, go ahead.
every child and every situation is very unique and special to that certain kid. So that also makes our job really fun and interesting. No 2 days are the same. So that's what I love about our unit. It's always keeping us on our toes and excited for future advances in the medical field. So I guess, can you touch on kind of like what it means for a kid to get this type of surgery?
Yeah, these surgeries are really long and complex, and some of them are as short as a few hours, and some of them are basically 20 to 24-hour surgeries. So obviously, the recovery from such a long event that's really stressful on your body, where the heart has to sometimes be stopped completely so that the surgeon can operate. It's really critical that the surgeon have a really good team around him in the operating room, managing the body and the patient while the heart is not working. They're actually on a kind of heart lung machine to keep blood flowing in their body because their heart itself is not pumping. So it's obviously a very complicated repair, and the recovery can be pretty tough on some kids. And so you and I are just there as physician and nurses trying to get these kids safely through that recovery period. Um, I think maybe we should talk about what a normal heart looks like for the people who are part of this art competition today. And Yuji, you're actually an amazing artist, and I've been lucky enough to work with you on this book. And here are some images from some of the drawings that you did. And so I'm going to show the
Yeah,
normal heart. Do you want to take us through it?
sure. So here is a normal heart that you and I are blessed to have. Basically, like Lillian was saying, this is all plumbing, and the inner workings of the heart just kind of flow depending on, your normal anatomy. So when you look at the blue side, the blue picture depicts deoxygenated blood. That means that the blood was used from the body, the oxygen was absorbed and taken, and then it drains back into the heart so that it can go to the lungs to get reoxygenated and then out to your body again. So this is a continuous cycle that helps us survive every day, every second. The blood from your upper part of your body is deoxygenated, so the body has already used the oxygen from it. It drains into the top portion, which is called the SVC. And you see the blue arrow saying from upper body, that drains into the right side of your heart. So this means the right side. If you picture yourself kind of flipped, where the right side is going to be, the left side that you're seeing now is actually the right side of your body when it comes to your heart.
AG. AG. That was my internet.
Oh, okay.
I have to go on my phone's internet now. Okay, sorry.
Oh, it's okay.
Wait, you
But
want
then
to
we
just
can't
redo
share
that part?
anything.
Huh?
Yeah, can I start over with the heart thing? Should I
Yeah.
just be more simple? Too complicated?
Yeah, I would just, yeah, because these are high school kids. Okay. Uh, okay.
Mm-hmm. Okay. So this isn't, are we recording?
Yeah.
So this is a normal heart. And you can see that I've colored the pieces that are blue. That means that the body has already absorbed the oxygen from that blood. And so it goes back into the heart in order to go and get reoxygenated. And you get that by going into your lungs and returning back into your body. So if you follow just the pathway, because it is plumbing pretty much, the top and bottom blue sections go into this right upper part of your heart, into your right bottom part of your heart, and then it goes out into your lungs. There it gets its oxygen, and then both come back into the left upper part of your heart, into the left bottom part of your heart, and those are where the red arrows are. This goes into your aorta, which is a very large vessel in your body that gives this oxygenated blood back to your body. So this is a cycle that's just like always just going around and around, and that's basically how we our body and our heart functions.
And I guess it's important for us to note that for these hearts to stay healthy, obviously, we advocate that people do some exercise, at least, walking around every single day, getting out of their house and with their mask on, taking some healthy walks and some running and some physical activity, and then avoiding as much sugar as possible and processed foods. Those are some tips for general heart health.
Yeah,
Um, Maybe we can talk about your second picture, which
sure.
is a VSD. Let's see. Can you see that?
So here, yeah, so here we have one of the very common heart defects that we see in the congenital heart disease world. Note how where the previous picture there was only red and blue coloring, now we have some purple. So there is a hole in the bottom two chambers of your heart. And this hole is called a ventricular septal defect, VSD for short. This hole allows communication between both sides of the heart that typically aren't supposed to communicate with each other. So I colored it purple because if red mixes with blue, then you get purple. So that there you can see that two areas that weren't meant to mix are now mixing. And these kids do need surgery ultimately. The hole is patched up by the surgeon, and they go back to living a normal life just like you and I after, if all goes well with the surgical operation.
That's great. I think we should also just note that these pictures are obviously artistic renderings and not meant to be
Mm-hmm.
used for medical or health advice. Obviously, you should consult a physician or a healthcare provider. But these are just beautiful artistic interpretations by Yeji so that you guys can have a better understanding of how the blood actually flows in the heart. Should we do one more?
Yeah, we could do one more.
Okay.
So this one is a little more complicated, but you can see this is called the coarctation of the aorta. Like I mentioned, the aorta is this big vessel that's gonna give all this nutritious oxygenated blood to the rest of your body. But where the arrow shows the coarctation, it's a narrowing in the aorta. So this just creates a little bit more of a difficult time for the blood to get to the rest of the body. These patients do need surgery as well to either get rid of that tiny little constricting area, or um, the surgeon can patch it and make it a bigger piece so that blood can flow more easily. I think it's just important to note that there are so many different ways a patient or someone can be born with a heart defect. You can have multiple variations of defects in one. A lot of times these babies don't just have one type of defect, they have many in one. So, but there is a lot of great technology and educational different pieces of just work that we do in the hospital that can really help these kids live a normal life just like you and I. But because we are born with a normal heart, I think it's very important to, take care of our bodies that we were blessed with, and also just remember that these kids are normal and want to be loved and want to be your friends as well too. So it's not that they're different. They might be in some ways, but overall they're just like you and I.
Yeah, and I guess in some ways each of us are different in our own way, and that's why we're special, and that's what makes humans different than robots, where robots can be built all the same. So maybe just in close, we could talk a little bit about our book and the fact that we were lucky enough to collaborate with Saloni Heart Foundation in the sense that we'll be giving away 10% of profits. So let me stop sharing here. And I'm just going to show people the book. And Yeji and I, Yeji was the artist for this book, and it's filled with all sorts of beautiful pictures and lots of anatomy and physiology questions, and really meant for the frontline provider for these kids so that everybody can have a better understanding of congenital heart disease and the physiology of it and the anatomy. So if there's anybody out there that wants to learn more about congenital heart disease, you can think about buying the book. And we're really happy that we can give some of the proceeds to Saloni Heart Foundation, which is just such an amazing foundation in Saloni's honor.
Yeah, and I just wanted to, bring to everyone's attention that just because you love science, it doesn't mean you can't be an artist as well. There are many different ways that you can be creative and combine all of your passions into one. And this is just one example of how I was able to bridge my love for art and my love for science and helping others, and bring it all together to be a CVICU nurse who also helped create a book. So just the possibilities are endless. And I encourage everybody to just have a great time today, drawing pictures and getting creative, and just really thinking about different ways that we can use hearts as a medium for art.
Yeah. Well, thanks everybody for your time. And Yeji and I look forward to maybe meeting you guys one day, maybe after COVID has gone away. We can finally all meet in person and celebrate Saloni and her life.
Yes, sounds great. Thank you so much. Good luck, you guys.
Good luck.
Fun.
Bye.
Bye.